Happy New Year, everyone, and welcome to McGill Cares, a webcast series supporting family and informal caregivers of people living with dementia. I'm Claire Webster, a former caregiver, certified dementia care consultant, and founder of McGill University's Dementia Education Program. I work with a dynamic team of leading healthcare professionals at McGill University to oversee this program, who include Dr. José Moret, Director of the Division of Geriatric Medicine, and Dr. Serge Gauthier, Professor Emeritus in the Departments of Neurology and Psychiatry. McGill Cares is supported by the Amelia Saputo Community Outreach for Dementia Care. The McGill University Dementia Education Program offers a comprehensive range of free resources to educate and support people who are living with dementia, their families and caregivers, healthcare professionals, and medical students. We have multilingual resources, and one of our most important resources is our Dementia Companion Guide, which is available in 14 languages, and you can download a copy for free. We invite you to visit our website at mcgill.ca/dementia, where you can access the educational guides, online courses, activity videos, and virtual support groups, and much more. So it is very appropriate as we enter this new year to have the topic of dementia prevention, and I'm delighted to welcome you to today's webcast. This is going to be an important, hopeful conversation because while dementia is a growing global challenge, we now know that many of the risks are within our control. And I have the pleasure of speaking with Dr. Samir Sinha, a nationally respected geriatrician and the lead behind the National Institute on Aging's Small Steps, Big Difference campaign. His message is simple and empowering: your choices matter. Nearly half of dementia cases could be prevented or delayed through small, healthy actions that we can begin at any age. So Dr. Sinha is a geriatrician and clinician scientist at Sinai Health System and the University Health Network in Toronto, a professor of medicine at the University of Toronto, the director of health policy research at Toronto Metropolitan University's National Institute on Aging, as well as a fellow of the Canadian Academy of Health Sciences and the Royal Society of Medicine. A Rhodes Scholar, Dr. Sinha is a highly regarded clinician and international expert in the care of older adults. As a former member of the Government of Canada's National Seniors Council and a current member of its Ministerial Advisory Board on Dementia, he helped to develop and now oversees Canada's National Dementia Strategy, and recently led the successful development of Canada's new National Long-Term Care Services Standard. Internationally, he serves as an adjunct professor at the Johns Hopkins University School of Medicine and the International Centre for Future Health Systems at the University of New South Wales. Furthermore, as a long-standing member of the American Red Cross Scientific Advisory Council and a recently appointed member of the Board of Trustees for HelpAge International, he remains committed to supporting the implementation and administration of unique, integrated and innovative models of geriatric care and support that reduce disease burden, improve access and capacity, and ultimately promote health. Wow, as you can see, what a way to kick off the new year and really to welcome Dr. Sinha to this special edition of McGill Cares.
Thanks for having me, Claire. It's a real honor to be here, and a nice way to ring in the new year with you. And I think a message of hope that there's a lot we can do to prevent and reduce our risk of dementia.
So I guess before we dive into all the dementia prevention, maybe you could begin by sharing a bit about your work in geriatrics and what motivated you to champion dementia prevention so strongly.
So, as a geriatrician, we're physicians that specialize in the care of older adults, and so often we're seeing people who want to say, "How do I age well? Like, what are the things that I can do to age in the best possible health, to stay healthy and independent for as long as possible?" But then, the majority of the patients we tend to see are folks who are often struggling with complex health and social issues, often that are interrelated in nature. So, people who might have multiple chronic conditions, issues that are now starting to impact on their ability to function and stay independent. And this is when they sometimes need that specialist expertise to kind of parse through all these different things to say, what can we do more of? What should we do less of? So we can help them stay healthy and independent for as long as possible. And for the majority of my patients, we're often dealing with issues of cognitive impairment. Often this is dementia. And, by that point, what we're trying to do is say, what can we do to potentially slow the progression? What are the things that we can do to help keep that person healthy and well and independent for as long as possible? But of course, when you're looking at these situations, you're always saying, are there things that we could have done earlier to prevent the onset of dementia or potentially delayed the onset of dementia in this person? And now what's exciting is there's a lot of great evidence that's emerging from around the world that's saying actually there are things that we could have done if we had done X or Y. We could have potentially prevented this case from developing in the first place. And then this older person in front of me's independence and well-being being threatened later on. So that's why I take a strong interest not only in how do we support good chronic disease management, but also what are the ways that we can support what I like to call healthy aging and a real focus on wellness and prevention.
So, one myth that we hear often is that dementia is simply an inevitable part of aging. But from what we're going to hear today from you, research is telling a very different story, right? So, can you walk us through the latest evidence and why prevention is becoming such a major area of focus worldwide?
Yeah, so I think there's a lot of stigma related to aging, and there's a lot of stigma related to dementia, and I think people have just assumed that as we get older, a whole bunch of things just start to break down, and we start having problems with our mobility. We start having problems with our bodily functions, like being able to stay continent. We start having problems with our memory and thinking. Often people will talk about seniors' moments that we'll more likely experience that we get as we get older, and people start thinking that, oh well, I guess that dementia must just be a normal part of aging, just something that will happen if you just live long enough. And I think it's really hard to dispel those myths. Certainly, as we get older, we experience more mileage. We're going to start experiencing more complications with our health and well-being, and certainly things that can affect our function. But one of the things we often do as geriatricians is we try and help parse out between what is a normal part of aging and what is abnormal aging, what is actually not normal, and what potentially is even preventable or reversible for that matter as well. And so when we start thinking about things like dementia, the Lancet Commission, which is one of these organizations that is dedicated to looking and sifting through the evidence around an issue, started issuing a series of reports every few years looking at the latest evidence around dementia and dementia prevention. And what they've been able to determine in their latest edition that was published this past year was that there are 14 things that we can now do that actually have pretty good evidence around them, definitive evidence to say that if you were to be able to tackle these 14 things, you could actually prevent or delay the onset of dementia. And so we'll go into them, I know, in more details, but it's a lot of sometimes motherhood and apple pie statements, maintaining a healthy weight, staying physically active, staying socially engaged, but also protecting our hearing and vision, making sure that if we have chronic diseases like diabetes, for example, or high blood pressure, or even high cholesterol, these are things that we should manage because all of these things have been implicated, for example, in affecting our overall brain health, and therefore can impact our brain's ability to maintain optimal cognitive functioning. And that's why if we can actually deal with these issues or prevent these issues in the first place, we know there's pretty good evidence now, definitive evidence really, to say that this could actually help prevent or delay the onset of dementia in about 45% of cases. So when you start thinking about, wow, upwards of half of dementia cases could be potentially prevented or delayed, That's huge, especially when you think of the numbers. Right now, we have about 750,000 Canadians who are estimated to be living with dementia. We know that that number is going to go up to around 1 million by 2030 and potentially 1.7 million by 2050, partly because age is one of the greatest risk factors related to developing dementia. But there's so many things around this as we get older that we know that if we were to better address them, we could potentially make sure that we're not one of those future cases.
So I recently attended a conference in Montreal. It was the Canadian Association of Gerontology, and they asked the question of people, and what are the two issues that you fear the most as you age? Number one was dementia, and number two was falls, right? And so we know that dementia is one of the biggest fear of most people, and many people just don't know what to do on how to potentially prevent it. So would you say that the Lancet Commission report is what motivated the National Institute of Aging to produce this incredible campaign called Small Steps and Big Difference?
Yeah, so smallstepsbigdifference.ca, that's where you can go. The materials are there in English and French. And there are videos, there are infographics, there's information there that breaks down kind of what the Lancet Commission came up with in pretty easy to understand kind of formats and ways, because we want to make sure that we get this information out there, because as you just said, one of the number one things people fear is losing their independence as they get older. And we know that dementia in particular, and dementia actually is a risk factor for falls. So dementia and falls themselves are two of the quickest ways in which these things could threaten our independence, our ability to live independently as we get older. So that's why the NIA decided to launch this campaign, because what we actually looked at was polling data that the Public Health Agency of Canada did in recent years. Claire, you and I both sit on the Ministerial Advisory Board on Dementia at a federal level, and we were seeing that despite there being good evidence like this out there, a lot of Canadians still are not aware there are things they can do to prevent or delay the onset of dementia. So part of our goal as an institute was to say, how do we help support, people across Canada to know there are actual things you can do when you fear this issue and you don't want to develop, dementia down the road. Knowing that there are active choices you can make on a day-to-day basis right from a young age. And we always say it's never too late. It's never too early to start doing things to protect and support your brain health. This is where we want to get that information out there so that people know the concrete things that you can do to help prevent or delay dementia.
So let's begin by viewing this outstanding video. And once again, say the website, because we want to make sure people go there and access all the resources.
Yeah, so it's smallstepsbigdifference.ca.
So we're going to watch the video, and then after that, you're going to walk me through the 14 modifiable risk factors.
I was terrified. I was angry.
We were like, this is forever going to change your life.
She's paying a handyman to put batteries in her remote for her.
She looked at me and said, I don't even know who you are.
Dementia itself is a progressive neurological condition. It's a disease that robs people of their independence.
My mom was a fierce, independent woman. And then it just got to the point where there was one too many times that she went missing.
She was my mom. She was my everything. She'd call me and have to tell me that my dad died. I would say, Ma, that happened like 25 years ago.
I thought it was going by so slowly. And now when I'm looking back, I feel like time went too fast. I lost my dad, but I didn't really lose my dad. But he's not all there with me.
My name is Dave Carpenter, and I have early onset dementia. You get this dramatic diagnosis of dementia, like you might as well, throw yourself off a cliff. Giving a diagnosis of dementia is one of the hardest things I have to do each and every day. The good news is that there's 14 simple things that we can actually do to really reduce or delay our chances of getting dementia by up to 45%.
This is great. I mean, I'm very surprised to hear about the hearing loss. That's very interesting for me.
It's really relieving to hear that there is research out there now to tell me what I need to do and what lifestyles I need to change.
Exercising, taking care of yourself, keep reading.
Smoking isn't just about lung cancer, it can be about dementia. Drinking can be about dementia, not just liver health.
These are relatively simple things that any of us can do that can make an enormous difference.
So we need them shared as wide as possible.
Know that if you do all of the right things, there's definitely a path now.
Take these 14 things into your doctor and say, I want these part of my conversation with you.
There is an incredible amount of hope. And so I urge everybody to go to the website, to smallstepsbigdifference.ca, and learn about what you can do to help prevent or delay dementia.
So that was really an amazing video, and I'm so impressed by this campaign, and really congratulations to you and your team and the National Institute of Aging for this initiative. It's just amazing. Thank you.
Thank you, Claire, and thank you for helping to raise more awareness about it. This is the goal. The Slate Family Foundation graciously, the Slate Family Foundation okay, let me see. Let's start it again. Okay, let's start it again. Go ahead, Claire.
Okay, so now I don't go. I'm so incredibly impressed by this video and this campaign, and really thank you to the National Institute of Aging and you and your team for spearheading, such an important initiative. And I really encourage our viewers to look at this campaign, look at the website, and to really share the material with others.
Well, thank you very much, Claire, and we really are grateful for you and your network for being able to share this video and share this campaign. This is something that the NIA has been very passionate about over the last year. We'll continue to be passionate about this, and our Small Steps Big Difference .ca campaign really was graciously funded by the Slate Family Foundation as part of a broader national dementia initiative. So we really want to get this information out there, and that's why I'm really happy to talk about the things that we can concretely do to prevent or delay dementia today with you.
Okay, so we're going to dive in now to what we call the modifiable risk factors. So these are things that people could do in their day-to-day life to hopefully prevent dementia. So we're going to start with physical activity. And I know that one of the questions that often comes up is, what type of physical activity should we be doing, and for how long in terms of minutes, and then how many times a week?
Yeah, so when we think about physical activity, the World Health Organization actually has good guidelines on this. And it actually says that no matter what age, it's not even specific to older people, it just says that we should be getting about 150 minutes of moderate exercise every week, or moderately intensive exercise every week. And so then people say, well, what does that mean? So moderately intensive exercise is exercise that's kind of getting your heart rate going, but you could still have a conversation. So you're going for a really fast walk, you might be going for a run, a bike ride, but you could still hold a conversation. Whereas more vigorously intensive exercise, probably you're not really, conversation keen, other than, hey, slow down. But vigorous exercise is something we say about 75 minutes a week, or we talk about moderate exercise, which most of us, it's kind of the most of us, feel comfortable doing. That's about 150 minutes a week. And again, you can turn that into how many times you want. So if we take 150, we divide it by 5 days a week, then that's 30 minutes, 5 days a week. And there you go. So you can mix and match in whatever way. And when people say, what is the best type of exercise for me to do? Well, we often talk about, as we get older, we talk about strength and resistance exercises. So things that might involve, kind of weight-bearing activities like lifting weights, for example. But, we talk about aerobic exercise too, that really kind of supports your cardiovascular health. And the best actual example of good cardiovascular exercise that's also a weight-bearing form of exercise is walking. So brisk walking is something that we can all do. You don't need any equipment to do that. And that's a good example of a form of exercise that's accessible. And again, it gives you a sense of how much time you need to be spending a week. And again, never too late, never too early to start doing that form of exercise. And better yet, do it with friends. And then that's a way that you can stay socially connected. You can pair it with, kind of socializing, which makes it a lot more enjoyable than just necessarily going for a walk on your own.
So I have sometimes people ask me the question about what if I have reduced mobility, but I really enjoy spending, hours in my garden, or doing like, light cleaning around the house. I mean, would that count, or do you really have to go out for a walk? Because the gardening question comes up quite often, actually.
Yeah, like honestly, at the end of the day, the key is that we need to just be moving. And again, if you're more limited in your physical activities, but you can do gardening, you can do light housekeeping, it's whatever you really can do, and just trying to, make sure that you build it in. Because when people say, what's the best exercise for me to do? I always say it's the one that you're most likely going to do. And again, there's just different forms. There's sometimes chair exercises that people can do, especially if you feel a bit unsteady. But the key is it's just about being active and trying to move your body in some sort of way that might even get your heart rate up. So the more you can move, the better you're staying mobile, the better you're getting your steps in. And even if it's low intensity, it probably means you're needing to do more than 150 minutes a week of that, maybe an hour a day of low intensity, but that again adds up over time.
So we know that what's good for the heart is good for the brain, or at least we assume people know. And I realize when I give my talks that people don't see that correlation between our heart health and our brain health, right? So a key factor is to really manage our heart health, our blood pressure, our cholesterol. So could you expand on that a bit more?
Yeah, so when we think about, people who have vascular diseases, so for example, people who've had strokes, people who've had a heart attack, for example, congestive heart failure, coronary artery disease, we often talk about, say, the plumbing in our vascular system. So think about you have a house, you've got pipes, for example, and over time, those pipes, have lots of stuff flowing through them, and then that junk that starts building up along the edges, for example. That's kind of the same way that over time those pipes in your house might get stiff. There might be junk that starts building up along the edges, for example, and if there's a blockage that occurs eventually, well, that's what could lead to what we call a heart attack. If one of those arteries or blood vessels, that's supplying oxygen to our heart, gets blocked. Or if that happens in your brain, for example, that could be a stroke. If a blood vessel bursts, we talk about an aneurysm or, that form of stroke. So again, this is where we think about our plumbing, and our plumbing goes into our brain. Our plumbing, kind of helps to support our heart, and the rest of our vascular health as well. And that's why we think about, okay, well, what are the things that can make those pipes get more stiff or get clogged up as we age? And that's where we start talking about high blood pressure, what we call hypertension, or we start thinking about high cholesterol levels. And what we've really found with the evidence through the Lancet Commission is that it's if you're diagnosed with high cholesterol in your middle age, kind of as a middle-aged person, for example, so in your 40s, for example, then this is where you probably want to start getting treated for that high cholesterol level, because that can actually help prevent future strokes, heart attacks, and most importantly here, a vascular form of dementia, if you will. And a similar way, if you're ever diagnosed with high blood pressure, remember that, when your heart is pumping, it's it's basically creating a high level of blood pressure for a variety of reasons. And that blood pressure, think of it as something like that pressure pounding and pounding and pounding against your brain. And so often we find people who have chronic, long-standing histories of high blood pressure. If we scan their brain, we see a lot of these micro vessels that have been in their brain tissue that start having what we call microangiopathic changes. So almost like these little mini hemorrhages, for example, not necessarily mini strokes, for example, and not certainly a stroke, but over time, that buildup, that long-standing, slow developing damage to the brain can lead to what we call vascular forms of dementia. So either way, we're basically saying if you've got high blood pressure, if you have high cholesterol, you basically want to keep those in check so they're not kind of harming those pipes, that plumbing, for example, that's key for our overall vascular health.
So there's an overwhelming amount of information about diet, right? About what is the right diet to follow between the Mediterranean diet and the ketone diet and all these diets. So what should people know about eating properly?
Yeah, so this is one of the things that hasn't been it didn't make the list yet, for example. So when we look at the 14 things that the Lancet Commission focuses on, they have a watch list which includes things like sleeping and diet, for example, because we don't necessarily have definitive evidence that if you eat this diet in particular, it's going to help you prevent dementia, for example. But there's pretty good evidence to suggest that there are some diets out there called the MIND diet, MIND, for example. There's the idea of the Mediterranean diet. And these are diets that really kind of prioritize, again, what your mom or dad would have said, right? Eat your vegetables, for example. Prioritize things like fish, for example, over red meat. Thinking about, nuts. Thinking about, kind of those sorts of kind of basic things that we know are probably good things for our diet, more whole foods as opposed to processed foods. So right now they don't necessarily have the definitive thing because often some of these aspects are enmeshed with other aspects. But related to diet, for example, if you will, that has made the list, for example, is maintaining a healthy weight. So again, if you're eating well and you're eating properly in reasonable proportions, as long as you keep your weight in check, for example, that will be helpful. If you're avoiding kind of processed and overly sugary diets, for example, that's probably less likely to lead to the development of diabetes, for example. And it may also kind of reduce your future risk of high cholesterol in those matters. And that's where things like preventing or treating your diabetes, making sure that we maintain a healthy weight. These are some of the things that we know, and maintaining a healthy cholesterol. These are some of the things that are actually related to that important, kind of those important aspects of diet. But we haven't yet been able to kind of pull out a specific diet and say, you follow this diet and we know this is going to prevent dementia. But you can imagine why we talk about diet, because we know diet is so intimately linked with some of these other factors that I've just mentioned as well.
So how risky is alcohol when it comes to dementia? Like, should we not be drinking? Because it's very controversial also. Sometimes it says, well, you could have 1 glass, 2 glasses, sometimes no wine. So how could we approach alcohol?
Yeah, so there are kind of 2 habits, if you will, that we talk about that have made the list, for example. The first one is smoking, and it basically says, don't smoke, right? So that's a pretty definitive, it's not a little bit of smoking is okay. It's like don't smoke at all. We know that there's overwhelming evidence that smoking can increase our risk of heart attacks. It can increase our risk of strokes. It can increase the risk of so many other things, for example. That's why we just know there's pretty good definitive evidence that there's no safe amount of smoking that is acceptable. So that's a good example of a habit where we just say nothing is acceptable. However, and again, it's never too late to stop smoking. So I don't want anybody listening to say, well, I've been smoking for a few years, or I smoked when I'm younger, so I'm doomed. Whenever you stop smoking, even if you stop smoking in your 70s, for example, that will significantly have an impact on your overall cardiovascular health. So it's never too late, for example. And again, this can certainly lower your future cancer risk, for example, for things like lung cancer or other forms of cancer that are linked to smoking. But when it comes to alcohol, we don't say no alcohol, we say less alcohol. So you can imagine that if you didn't drink any alcohol, that's probably the safest thing to do, because we know every time you drink, can affect, our brain cells, for example. And, there's always those things that we heard, I think, when you're younger, that every time you have a drink, it kills a few hundred brain cells. But, we have, billions and billions of brain cells as well. So again, what we tend to say is less alcohol. And generally what they try and say is that I think that the guidelines say that, men, for example, shouldn't be having more than maybe 14 drinks in a week, for example. And I think women, it's about 7 or less drinks a week, for example, is what they generally say is an appropriate amount of alcohol. And that ideally, the less the alcohol you drink, even the better, for example. So again, anything we can do to reduce alcohol consumption. That's why, mocktails are becoming quite popular. For example, there's de-alcoholized beer, for example, which is kind of interesting, because beer and spirits, for example, apparently, I was learning this the other day, it's not like they take these drinks that we love and then they pull out the alcohol. They just arrest the fermentation process that much quicker. And that way they stop it by the time the alcohol content gets to about 0.5%. They don't let it get up to 5 or higher than what it would actually be. So this is where, again, it's helpful to see that there's so many different options out there to help people lead to safer habits, for example. So again, it's not that we definitely say don't smoke, but when it comes to alcohol, we say less alcohol, or and try and limit the amount of alcohol you take in. And again, there are WHO guidelines that now suggest kind of what those limits should be. Again, less usually than 7 drinks a week for women, or 1 drink a day, and same and for men, it's about less than 14 drinks a week.
What I found very impressive was one of the most important risk factors is our social health, staying socially connected. And why does staying socially connected matter so much for cognitive health? That's one question. And number two is I know that with the Lancet Commission, they added 2 new risk factors, which was hearing loss and vision loss, right? So, and I assume that hearing loss and vision loss have an impact on our social connection. So perhaps you can explain that.
Absolutely. I mean, again, I think perhaps people who are listening are starting to kind of get a theme here, right? That so many of these things are so interlinked, but they all kind of make sense, right? So think about this. We know that when you get together with somebody else, for example, you're being stimulated, right? They ask you a question, you respond. So you're actually stimulating your brain, by figuring out topics to talk about, jogging your memory, reminiscing, doing whatever. So all of that brain activity, that's actually kind of a way of keeping ourselves what they call cognitively stimulated. You're exercising the brain to kind of think about, what am I going to say? How am I going to answer? Just like what we're doing right now. This is a form of staying connected, staying socially engaged that way as well. And that's why we also say, related to that, I'm going to throw another one of our risk factors in here. It's also, cognitive stimulation. So it's that idea that things that we can do to stay engaged. So that's why we even talk about education. The more you stay educated, the higher level of education you attain, especially at a young age. So those people who finish high school are less likely to develop dementia compared to those who didn't finish high school. I see in my practice people who have multiple degrees, for example, have a lot of what we call cognitive reserve. They've just basically, as they keep learning new things, our brains are kind of creating all these new connections, for example. So developing that cognitive reserve. That's why we talk about staying, building staying, kind of interested in activities, having a sense of purpose, doing those sorts of things, keep us engaged. And one of the best ways to stay engaged is by being socially engaged with others. So getting together with other people is a great way to promote cognitive stimulation. But one of the things or two of the things that can get away, as you alluded to about staying cognitively stimulated, are if your vision and hearing aren't good. And again, that's what you mentioned, for example, that, the Lancet Commission this year added vision loss and previously had added hearing loss. And basically the advice here is that if you have a visual problem or you have a hearing problem that's correctable, get them corrected. Because we often know, and people can relate to this, if you can't hear what's going on and it's hard for me to hear what you're saying, I'm going to less likely want to engage with you because I can't hear what's actually happening in the room. I can't actually hear what you're saying, and sometimes that's really embarrassing. So I'd rather just not do any interaction at all than embarrass myself. That's why we say the more you can hear, the more you understand what's actually happening, and then that takes in information into your brain. It allows you to continue developing that cognitive reserve. It allows you to stay cognitively intact. In the same way, if you can see properly, for example, you can read, you can see what's going on, you can understand and what's actually happening. And so that, again, that information, sensory input from your ears or your eyes, again, are stimulating your brain, for example, and if you can do those sorts of things, if you can engage with your vision and your hearing, you're more likely to want to engage with others as well. So that's how all of those things end up kind of being connected, or how I've reasoned them out as to how it all works. Because sometimes in some of these cases, they don't know exactly what the mechanism is. But that's how I kind of reason it out for me of why all these things are really important.
And I think even just learning, you could learn new games, like if people are playing Mahjong or playing bridge. And I have to say, I recently have become absolutely addicted with pickleball. And to challenge myself, I recently joined a local club where I did not know anybody. And I'm playing this sport a few hours a week. I'm speaking French, which challenges my brain because I'm speaking another language. And I'm having connection with people. So I think what I see a lot is that when people are taking, their retirement, even sometimes people in their mid-50s that are taking early retirement, all of a sudden they're saying, well, what do I do now? And then it's easy to become sometimes depressed or saying, what's my purpose, right? And so it's to really, I guess, encourage people to try something different, step out of your box, learn something new. But make sure that you're not staying socially isolated. So I think that would lead maybe to my next question is, what is the correlation between, also perhaps depression, right? Like maybe some mental health issues that could come into play.
Absolutely. So when we're making a diagnosis of dementia, we sometimes try and rule out kind of, could there be another thing happening, for example? And often we're thinking about mood issues like depression and anxiety, but depression in particular, because we know that if people are depressed, sometimes the symptoms are also problems with cognition, for example. If you're anxious or you're depressed, for example, it sometimes means that you're not able to kind of think and concentrate as clearly as you were. And so that can actually affect your cognitive abilities. And so that's, again, as you noted, one of those things that's been associated through the Lancet Commission is basically saying that if you actually have poorly treated depression and potentially other mental health issues, for example, that could actually increase your future risk of developing dementia as well. And the way, again, back to our previous example, the way I liken that, if you're depressed, for example, if you're socially isolated and you're not getting out and interacting with other people, you might end up becoming isolated. You might become lonely. That might trigger depression, for example. And so that's why, and that might be the way, or if you're depressed, for example, you're less likely to want to be motivated to get out there and do things. But one of the ways to kind of treat or manage depression is to actually start interacting socially with other people, getting out there, doing other things, as well. And that's why, again, we can start seeing how these things can be connected together. That, again, if you are depressed, you might, kind of restrict your activities and be less interested in wanting to do things. But if you are actually, getting engaged, getting out there, doing more, then that's going to likely lower your risk of feeling isolated and lonely and potentially depressed. And that's why, again, that social connectivity that we talked about, that's so important. It's kind of that idea of combating social isolation, combating loneliness, combating depression, for example. So again, how all these things, when you actually look at the 14 factors, is basically saying, as we get older, stay engaged, find a sense of purpose. And even, Claire, when you're talking about your newfound love of playing pickleball with colleagues, you just told me a bunch of factors that you're addressing. You're staying socially connected. You're challenging your brain because you're being forced to speak, French, for example, as opposed to English. You are getting that physical activity, right? That all of a sudden, there's all these different things that you're actually doing at the same time. And presumably you're wearing your glasses, for example, or, so that you can see well of what you're doing. So otherwise you wouldn't feel comfortable doing that. So again, it's all these things that you're doing, and that exercise is helping you maintain a healthy weight. If you have high blood pressure, high cholesterol, these things are going to help manage that. This is going to help prevent or better manage diabetes. So you can just start seeing how, as we go through those 14 factors, so much is interconnected. And that's why it makes it a little less intimidating when you start thinking about how they all fit in together, and how it's more doable than you actually think to help prevent and delay the onset of dementia.
So how important is sleep? Because sleep did not make the list, but how important is sleep?
Yeah, so sleep is one of those things that's kind of what they call on the watch list, right? So they're saying right now we can't say definitively this is how much everybody needs to sleep. I think partly because everybody needs a different amount of sleep, for example. So some people may need less sleep, other people need more sleep. So it's not like we say, aha, you need to get exactly 7.5 hours of sleep, and this is the type of sleep we'd say that you need to get. Generally, we say people should be getting a good night's rest so you don't feel groggy or tired in the morning. People should be able to get enough what we call deep sleep, which is kind of that in more intense form of sleep where we're more likely to be clearing out those neurotoxins in our brain, in that way. So we know that sleep has an important role to play. We don't know exactly, again, kind of like diet, know exactly how much or what type in that way, but that's being figured out. So that's why they call it on the watch list. They're saying we're keeping an eye on this, and we think that when time we're going to have more clear evidence that's going to really lay this out. So that's why that remains on the watch list. But hopefully we're going to have a moment to talk about two things that we haven't talked about so far, which is about head protection, like wearing helmets, for example, but also reducing our exposure to air pollution. So whenever we're ready, let's get into those.
So that was my next question, is actually concussion. So, and when we talk about educating, like the importance of brain health education beginning at a much younger age, I remember when my kids were in school and I would hear parents talk about the number of concussions their children have had playing hockey or skiing, etc. So what is the correlation between head injury, brain injury, and dementia?
Yeah, one of we've always heard about boxers, for example, that those who are often boxing, and often in early days people didn't wear headgear, and it was totally common to have a total knockout where someone just hit you in the head and you basically had a bunch of concussions. And so we know some of our most famous and beloved boxers from bygone eras ended up developing dementia later on because they were having repetitive brain injuries, for example, repetitive brain trauma, concussions, those sorts of things. We also talk about why we really value the importance of wearing a helmet when you're playing hockey or when you're playing, for example, football, American football. These are sorts of things where when your head is more likely to experience a knock, for example, or a bump, it's really good to wear a helmet. And another common thing is if you're on the road, for example, if you're on a scooter, for example, if you're riding a bicycle, why it's always important to be wearing a helmet as well. And so this is one of the things that we talk about, the real importance of head protection, because every time your brain gets hit, for example, again, it's kind of that idea that when I'm talking about high blood pressure, where you're internally pounding the brain, this is kind of an external force, for example, it's kind of pounding the brain, putting impact in that can actually kill brain cells and create more permanent forms of injury. And so we talk about people who've been in motor vehicle accidents, things where they've actually had a head injury, for example, and therefore have kind of that permanent kind of brain damage, for example, that could affect their ability to think and remember as well. So that's where we talk about. That's why we just say, if there's a risk that your head could get injured, put on a helmet, for example, or figure out, is there a way I can play this sport which doesn't involve too much tackling, for example. And that's why I think sports that kids are often playing now are really thinking about the issue of head injuries and how we really reduce that. But I bike to work every day, and I see so many people not wearing helmets. I see people on scooters not wearing helmets, and some of my colleagues, we joke and we call these organ donors, if you will, because I'm like,
Oh
if
my
you have
gosh,
a
yes.
slip and fall, forget the concussion or the
Mm.
dementia. If you crack open your head, you might be that might be it. So please wear a helmet, because that's a really key thing that we can all do. And yeah, it might mess up your hair a bit, but it's better that than a little bit of messed up hair is better than a little bit of well, like the other consequences. So there's that piece, but also kind of related to that, I like when you're out on the road, when you're outdoors, for example, it's thinking about our exposure to air pollution. So that was one of the new factors that made the list this past year. And it's basically saying that, when they have those weather advisories, they say it's a big smog day or the wildfires and that, and they say you probably don't want to be outdoors, or you probably want to be wearing a mask. You can imagine in some places around the world where it's so polluted every day, you literally can see the air. All those small particles get into your lungs, can get into your bloodstream, for example, can create inflammation, and therefore, like that high cholesterol, that high blood pressure. These are things that, again, can create more vascular injuries as well. That's why we talk about reducing exposure to air pollution whenever possible, is so important, because that can ultimately affect our brain health as well.
So some people don't really have a choice of where they live, right? Unfortunately. So, I mean, would you recommend wearing a mask? Like, because, sometimes people, if you live downtown or you live in areas where there is higher environmental exposure, what could they do to minimize
Yeah.
risk?
So for example, I sometimes see people who are, biking, for example, especially if they're biking on quite heavy polluted, roads where a lot of vehicles have exhaust fumes, coming out, for example. Then that's, I see people wearing a mask, for example, in that way. And that's a smart idea, because again, you're reducing your exposure to air pollution, from that perspective. Sometimes again, on those, depending on where you live, and if you have those heavy smog advisory days, for example, not a bad idea to wear, to wear a mask, for example. And certainly in other parts of the world where it's chronically polluted, when you're out there, out and about, you can do that. And when you're indoors, for example, you can think about what are the air filtration systems I have, like a HEPA filter, other things that might help keep the air that much more clean, for example. So again, to reduce that risk of being exposed to air pollution.
So I have time for two more questions. One of them is the one that I'm sure you get all the time. So a big fear for many people is genetics. So if someone has a parent with dementia, how much control do they realistically have? So like in my case, right, my mom had Alzheimer's disease. What is my risk?
Yeah, so it's a really good question because I think when I get this question all the time, and really where genetics seem to play more of a factor from what we can tell is in really early onset dementia. So if you had a mom or a dad or a relative who developed dementia, for example, in their 40s, for example, in their 50s, that's what we call early onset dementia. And that's where we'd say there's probably more of a genetic kind of factor that could be at play that could put you at risk, increased risk as well. The key is that one of the non-modifiable risk factors, or the most common non-modifiable risk factor for developing dementia, is age. So as we get older, the older we are, the more likely we'll be living with dementia. And just to give people perspective, only about 5% of people 65 and older are living with dementia. But when we start going up to people who are 75, 85 and older, that's where we start seeing 1 in 4 people living with dementia. And so a lot of people say, oh, my grandmother in her 90s, she started developing dementia. So does that run in the family? And, maybe there are other factors like heart disease or other things that could say, yeah, it run in me if increased grandma's risk. But, we know that it becomes so common later in life, to those levels, that I just say, yeah, it runs in your family that way. So you might want to look at the broader factors, but it doesn't mean that you're necessarily genetically predisposed, to dementia. So I'd always say again, I would look at all these other risk factors and then say, how could those have impacted my grandmother or my mother's situation? And if those things have been modified, maybe they would have not died of dementia, but very much died of something else as well.
So as it's January, and January, the new year, it's always the resolution time for most people, right? So the last question is, so for viewers who want to take action like right now, okay, what would be, let's say, 3 simple steps that they could begin doing like right away?
Yeah, I'd say, because loneliness and social isolation are so common, and especially at younger ages too in our society, we find that like as people get older, I think they get better at dealing and addressing social isolation and loneliness. Because I think once you experience it, it's awful. So I'd say make friends, right? Make friends and make sure that you're doing things with your friends, staying social, staying connected. These are good things to do. I'd say try and look at how much you're exercising and see what kind of exercise that you may be interested in doing and how you can incorporate it into your daily your kind of daily schedules or your weekly schedule so that you can make sure that you're really maintaining your cardiovascular health that way. And then I think, with some of these other things, if you have, take a look at your blood pressure. Make sure that your primary care provider, is keeping an eye on things like your blood pressure and that you are too in your cholesterol. Because these are some of those simple things that, again, if you identify them early and you manage them proactively, again, these can really reduce that future risk of dementia as well. So those are just 3 of the things I would say spend some time taking a look at the list that we talked about today. Again, it's small steps, big difference. We have a nice 1-page infographic. You can look at all the things there and you can kind of say, okay, well, how am I going to start thinking about these things more consciously so that if someone's saying, hey, let's go for a bike ride, you might say, oh, great. And do we have a helmet available? I'm going to wear one of those. Again, it's just those little things we can start incorporating and appreciating that these aren't just nice things to do, but they're things that could actually help prevent or delay dementia in your case.
Well, Dr. Sinha, thank you so much for joining us today, and really, congratulations for your insight and leadership in this space. And wow, your patients and the families are so fortunate to have you as their geriatrician. So thank you so much for being my guest today.
Thanks for having me, Claire, and Happy New Year to you and to all of your listeners as well.
Thank you so much. So this webcast is an initiative of the McGill University Dementia Education Program, which is funded by private donations. If you would like to make a donation to our program or for more information, please visit us at mcgill.ca/dementia. You can also sign up for our newsletter to find out about all of our ongoing programs and resources that we are developing. So thank you so much for joining us.